Hi everyone, my name is Rachel Rodriguez and I'm here to discuss Nursing Leadership and Management 4405. I'm here to talk about the facility, the current issues that we're having, the quality initiatives and improvement gaps in care are one of them. The main issues are the trauma times. Trauma times are usually the initiation of a transfer is usually no more than 2 hours. So our facility has been going through some issues reference to the trauma times being more than 2 hours, up to 5 hours. And based on that, we have some issues. On the SWOT, we have several. Of course, the SWOT is talking about quality, the positive impact and the negative impact. Then the positive impact of the positive impact and strengths of the emergency room is that we are 60-mile radius, which means that we get a lot of people around the surrounding areas in case of an emergency. Number two is that we evaluate at least 700 to 900 patients in a month. Another thing is that we had some facility changes in reference to staff and requiring quality care and quality nurses and physicians to be trauma certified. The RNs are supposed to be certified in PALS, ALS, TNCC, and ATNCC certified. All staff are require 8 hours orientation to start, and they require an additional hours for them to be compliant and make sure that they pass their competencies to be in this trauma unit. As far as opportunities, the opportunities is that you have quality nurses, quality staff, and to include the physicians. The physicians are also certified, board certified to work in trauma. The opportunity is recently they went through some they had to bring it up to the board, and the opportunity was that they were able to get a pay increase with all the credentialing that they have. Their pay increase went up to $35 an hour, which is really good. But of course, the job is very hectic and it's about trauma, and they're supposed to be ready to respond in case of an emergency. As far as the weaknesses and threat, the weaknesses for the hospital is, of course, we're in a rural area. So a lot of patients sometimes tend to bypass us, but but the majority we do get, like I said, we're a 60-mile radius. We're just far away from everyone. Another weakness that we have is poor staffing. We had to contract agency staff to come and assist, which there was some language barriers that depending because of the cultures and where some of the nurses come from don't understand the cultures that's here locally, which is more than 70% is Hispanic. So there's a lot of barrier, and as far as the other weakness is contracting physicians that we previously had was they were not they did not want to go with the vision of the hospital, and so our satisfaction surveys decreased, our phone views, and the quality of care wasn't there. So the threats was the loss of money of Medicare and Medicaid guidelines, because there was no, the reimbursement rate was low because the documentation wasn't there. So a lot of that is in reference to our facility. The next thing I wanted to talk to you guys about was the goal. The goal is to increase patients' quality of care and make sure that they're safe. We were not to par in reference to JCO EMS trauma standards in the ER based on times and the time that the patient got to be seen, the time that the patient was actually initiated care, or if it needed to be transferred, the patients were not transferred at an adequate time. So, of course, you have issues with poor outcomes, death or delay of care causing other issues for the patient. So, as far as the hospital, they had to make a lot of changes. They had to report to bring all this information of their concerns as far as patients not being satisfied with the care because of all of these issues. They had to bring it up to the board. The board is the one that oversees and provides the funding and approves the funding for all these changes to come to play, which means increasing the pay. As far as physician staffing, they went ahead and went through some changes and switched out the previous contract agency for physicians, and in 2017 they brought that to the board, and in February of this year they made those changes. They have a new set of physicians in the facility, and their outcome has been amazing. The patient satisfaction survey has increased. Patients are a lot happier. They feel like they're getting the care, the quality of care that they deserve. Mind you, with all that being said, there's a big cost. How the saying is, you're gonna pay what you have, and it's based on quality of care. So they're paying for it. I'm talking about the hospital, to get the care, the providers that they need to provide the care that the patient requires and that they need and they deserve. So as a department, everyone comes into collaboration as far as what can they do to make it better for the patient and for the facility in itself, and the outcome has been very positive. As far as the budget, I do know that the increase in pay was from $750,000 in 2017. The increase in the pay overall to have all this manpower changes was $2 million in increase. So as far as however, the patient's satisfied, the care is been amazing. Recently had a situation to where a patient went to the ER. That patient within 15 minutes was out of Fort Stockton. Survival was amazing. And so as far as the care, the providing the care, the timeline in the changes was pretty rapid. So I'm excited about the changes and the outcomes. So our patients are very pleased. So I'm really excited. You guys have a great night.